Spinal manipulation might be one of the most misunderstood tools in orthopedic therapy. For decades, it's been surrounded by fear, myths, and controversy, sometimes with good reason. Yet the research is clear. When applied appropriately, it's safe, effective, and can make a real difference in patients with musculoskeletal conditions. The problem? Most physical therapists aren't using it, and patients are missing out. And even those who do utilize it, they aren't using it enough. So my goal with this video is to get physical therapists manipulating more. To do this, we'll be cutting through the noise, look at what actually happens during a manipulation, and show how to integrate it into your practice with confidence. Spinal manipulation has been around for decades, yet its reputation remains, let's say, complicated.
All right, take a deep breath inside profile. Take a deep breath in and deep breath in, deep breath. Deep breath in and deep breath in and all right, take a deep breath in and
viral social media clips, sensational headlines, and poorly executed techniques have distorted the public's perception, and in some cases even led medical professionals to recommend against its use. Too often, misconceptions and fear overshadow the facts. But here's the reality. When performed appropriately, research consistently shows that spinal manipulation is not only safe, but also an effective treatment strategy for a wide range of orthopedic conditions. So what actually happens when a joint is manipulated? The high velocity, low amplitude thrust moves the joint slightly beyond its normal physiologic range, but well within its anatomical limits. This produces a rapid stretch of the joint capsule, resulting in a cavitation, the familiar pop sound, not bones grinding, but a pressure shift as gas bubbles and synovial fluid collapse. From a mechanical standpoint, manipulation helps release restrictions, restore joint motion, and reduce stiffness in surrounding muscles. But the most clinically significant effects may be neurological. The rapid thrust stimulates high threshold mechanoreceptors in muscles, ligaments, and joint capsules, sending a burst of sensory input to the spinal cord and brain. Research shows that manipulation can reduce pain through descending and altered nociceptive signaling, activate inhibited muscles, particularly the deep stabilizers like the multifidus, the glutes, and transversus abdominis, which often show delayed activation in low back pain. Improve mobility not only at manipulated segments, but regionally through reduced guarding and improved muscle tone. Enhance sensory motor control by recalibrating how the central nervous system interprets joint position and movement. Facilitate faster recovery when integrated with exercise, especially for acute and subacute pain conditions. But here's the critical piece, and it's important for both clinicians and patients to understand. While the benefits of manipulation are real, they're also time-sensitive and patient-specific. A well-executed manipulation creates a short-term window of opportunity where mobility improves, pain is dialed down, and reflexive muscle activation resets. Research suggests that this window is open for only about a couple hours, sometimes up to a day or two. That means the real value of manipulation isn't just in the adjustment itself, it's in what you do afterward. This is the time to load, retrain, and reinforce proper movement patterns, so patients can build on the immediate gains and make them stick. Now, all of that sounds great in theory, but what does the evidence actually tell us? Well, for low back pain, a large JAMA systematic review found that spinal manipulation therapy provides modest but clinically meaningful short-term improvements in pain and function for acute presentations, with mostly minor and transient side effects like soreness or stiffness. Our own profession's JOSPT Low Back Pain Clinical Practice Guideline, released in 2021, is even more specific. Physical therapists should use thrust or non-thrust joint mobilization to reduce pain and disability in both acute and chronic low back pain conditions, usually alongside exercise and other active strategies. This is an A-level recommendation, meaning it's supported by high-quality evidence. Other professional guidelines reinforce this. The American College of Physicians lists spinal manipulation as a first-line option for non-invasive care for acute and subacute low back pain. For neck pain, the Neck Pain Clinical Practice Guideline, released in 2017, recommends thoracic manipulation, and, where appropriate, cervical manipulation or mobilization, combined with exercise for patients with mobility deficits or neck pain with headaches. The key takeaway? Spinal manipulation is evidence-based, guideline-supported, and safe, but it's not a standalone solution. Manipulation doesn't rebuild strength, retrain motor control, or correct the movement habits that perpetuate pain. Without exercise, education, and functional training layered on top, gains from manipulation often fade, leaving patients chasing repeated adjustments for temporary relief.